Government and the doctors has to be in such a manner that the doctors have a voice, and doctors have a very important role in decision making, and we are all here for the service of the people of the state of Goa, and we all have to ensure that we do our best to see that the best equipment and best type of infrastructure is provided to the doctors, especially Dr. Ponraj. I think Nilsa, I was thinking of the Neuro Navigator because that was the first equipment we procured, I think when I was minister earlier.
That was
So
upgraded.
basically, we are also going to do the same thing in the new super specialty hospital. It's our vision to see that every OT is well equipped with respect to what the doctors require, and state-of-art facilities to be provided. Just now in the morning I was speaking to somebody, some top special. Government of India has also said that we can go in for different models in running the super specialty with our doctors. Our doctors will be heading everything.
Today we had commissioning of Neurosurgery operating microscope at the hands of Honorable Health Minister Sri Vishwajit. This microscope is a latest 4th generation microscope which has got many good features, and it is one of its kind in whole state of Goa. Nobody has got such a microscope. It's worth around 2 crore rupees. We had earlier one microscope which we exchanged in this to get this microscope. The advantages of this microscope, as per the neurosurgeon Dr. Ponraj, is that it gives very clear picture of brain tumors. It can be connected to navigation machine. It can also be used to find the resection part of the tumor, because most of the tissue in the brain is vital. We cannot fiddle with this organ, and it is very, very sensitive surgery. So with this microscope there could be 25 times enlargement of the tissue. The tumor can be demarcated very nicely, and it can be removed from the brain. Also, there is one advantage that if you inject dye with this microscope, the color tumorous tissue will show change in color, which will help the surgeon to demarcate again the margins of the tumor. And many a times if the tumor is left over, you get recurrences, so that fear is gone. So I hope that with this microscope, the people of Goa, especially patients who come with head injuries, also you can use this, and patients with the brain tumors will have a lot of advantage, and they will get best of the treatment.
Zeis Pentiero operating microscope which we use for neurosurgery. Microscope is like the right hand for all neurosurgery cases. Without microsurgery and microscope, we cannot do most of the spine surgeries and brain tumor surgeries and vascular surgeries. Microscope helps us in many ways. It gives us light in the depth of the areas, gives magnification, and because of which we can protect the critical structures, both the nerves and the blood vessels. We have to operate through narrow corridors, sometimes only 1 centimeter, which is all available for removing a tumor which may be 10 times the size. Then only with microsurgery we can remove this tumor safely. Third, it helps us making sure that the blood loss is minimal and controlling the bleeding. The microscope is special in this sense that it's got an automatic balancing system which makes it a weightless system. During surgery, which may last up to 6 hours, we may have to adjust the microscope several times, and this may waste time and patients under anesthesia for longer time. This counterbalance weightless system helps us minimize the time spent on processing this system. It's got a high definition imaging, it's got scopes for 2 assistants to see, and the images can be seen in the TV screen also.